Okay.
Hello, it's Dr. James Whillans from LifeWorks Family Chiropractic. Welcome. We're going to do a success story of the week with Marianna. Thank you for doing this, Marianna.
You're welcome.
Absolutely. Now, Marianna has been a patient here for 2 months, and for the last few years, Marianna had been having a burning pain in her feet. How was your feet feeling?
Great. Absolutely.
Oh, how were they feeling
great.
before? Sorry,
Oh,
how were they feeling? Like, describe.
It was an awful feeling. I woke up 2, 3, 4 times a night with a burning sensation, incredible burning, and pain. And then I went to my family doctor.
Yes. Now, Marianna she went to her family doctor,
Yeah.
she was sent to a specialist, and the specialist did all the testing, and at the end, couldn't find the problem and decided that Marianna it was all in her head. She had a sister who was an amputee, and he figured it was all in her head. There was no physical problem that he could find whatsoever. Is that right?
Exactly.
Okay.
That was that.
Now, I met Marianna, and she came in for a checkup, and we did some testing that the specialist did not do. We checked for subluxation. Subluxation is an interference in the nervous system along the spine that medical doctors don't check for. And that's not a problem that they don't check for. That's why there's chiropractors. Every medical professional has their own specialty. Ours is interference in the nerves. I found interference in Marianna's nerves in her upper neck and then in her lower back, where the nerves exit and go down to her feet. And that interference and that disruption was causing burning pain. So we started, how many adjustments did we do, Marianna, before the pain began to subside?
About not even a month after, I could sleep through the night, and then it came once in a while, a little bit burning, but just for a half a minute, and it was fine. And now I have it perhaps every 10 days, very short.
Just a little bit.
Yeah.
So now she has a little bit
Yeah.
every 10 days. And if I
Yeah.
recall, it was after just the first few adjustments
Yes,
that you mentioned it was starting to get better.
Yes.
So there's really no
yes.
coincidence
No.
about what caused it to get better. No.
No.
Now, we've done a full re-exam, and as many of you know who follow us, chiropractic helps with your overall health and well-being. When you clear nerves, you can't help but have many health improvements. It's just natural because we didn't treat Marianna's feet. I cleared her nervous system. Her body's been healing itself, and when the body heals, many things will improve. So I'm going to read the list. This is the list that Marianna wrote out of improvements at her progress exam. So 90% better coordination, 85% better circulation, 20% better digestion, 90% less tingling, 60% better posture, 100% better vision enhancement, 80% better bowel function, 80% better able to handle stress, 95% less muscular pain, greater flexibility, 70% stronger immunity, 90% better improved blood pressure. And the other thing that was really neat that came up that Marianna was mentioning, she was having a pain and pressure in her chest in the morning and didn't say anything to her husband because she was worried or didn't want to worry him.
Yeah.
And that now is all gone.
That's gone.
Yes.
Completely gone.
So
I am so happy.
good.
Yeah.
I was just going to ask you, how do you feel overall about chiropractic care?
Absolutely stunning and happy, and I recommend that to everyone.
Chiropractic is
Yeah.
awesome. So
Yeah,
if you haven't
it
been
is.
to a chiropractor, especially one that checks your nerves and for nerve interference,
Yeah.
I highly
lovely.
recommend that you do that and make it a great day. Take control of your health and make sure that your body's healing itself the way it should be. Thank you.
Thanks
Marianna.
so much.
Okay.
Thanks.
Thanks for doing that.
No, thanks.
All right.